Hello everyone, I'm Dr. Sreechithra from Exemplar Healthcare. Today I'm here to talk about GERD or Gastroesophageal reflux disease, because this is one of the commonly seen disease condition, especially after the corona season of ours. So in today's section, let's discuss what is GERD, what are the symptoms of it, and how can we prevent it, what are the treatments available. All these things we can discuss in detail in this section today. To start with, what is GERD? So GERD, as the name suggests, is a reflux disease. The stomach content of yours is getting reflected back to the esophagus and to the throat. So that is what GERD is about. So what are the symptoms that we see in GERD? The chest pain or the burning pain across the chest is one of the commonly seen symptoms associated with GERD. Sometimes it can get localized just to your chest, or it can radiate to your hands also. Along with that, you would be having anxiety, palpitation, sweating. All those symptoms, it mimics like a heart attack, and it is very difficult to differentiate which is what. So that is the reason why if you are 40 and above, and if it is not coming down with antacids in a few minutes, make sure that you go to the hospital and get the ECG done. And the second symptom is that whenever, usually in the morning, you will be getting that bile rising or the taste of bile in your mouth. So that is the second symptom that you can see, and definitely the bile rising will be there, so the throat will be always irritated. You will be presented with always that kind of a dry irritating cough. It will never go away with any cough syrup or any kind of treatment. It will be persisting on and off, coming and going. That kind of irritating dry cough will be persisting. And sometimes if the intensity of the disease is more, there will be severe pain in your throat. Initially, you may mistake it as a tonsillitis, but if you examine closely, you will be able to see the scalding caused by the acid burns. How does this GERD occurs? When you swallow the food goes through the esophagus. Esophagus is a 25 centimeter long fleshy pipe. The food goes down and it enters the stomach. At the entrance of the stomach, it is not a free flow. Okay, there is a sphincter which is guarding the esophagus, and we call it as esophageal sphincter. It is actually made up of a very thick muscle, and it acts as a valve. So whenever the food touches this valve, it automatically opens up, and when the food enters the stomach, it will close tight. Okay. Stomach mucous membrane is one of the thickest and one of the toughest mucous membrane that is seen in our body, because it has to withstand all the acids, all the enzymes, all the churning process, everything it has to withstand. So the stomach is being covered with such a thick layer. So during the process of this digestion, of this churning and grinding that is happening in the stomach, the esophageal valve or the esophageal sphincter will make sure that the contents does not escape back to the esophagus. It will be closing tight. But for some people, because of many reasons, the esophageal valve or the sphincter may not work properly. It become a bit loose, so that the stomach contents automatically escape back to the esophagus. So the esophageal mucous membrane is not that tough like that of the stomach. It is very light, it is very sensitive, it is very tender. So if the stomach content, if it rises back to the esophagus, it will immediately burn the area, because this mucous membrane over there is very light, very tender and very sensitive. So depending on how much quantity and depending on how high the food or the stomach content rises, you will get symptoms accordingly. So now let us look into the factors which will actually contribute to the loosening of the esophageal valve. The integrity, the function and the resilience of the muscle will gradually comes down with age, with systemic diseases, with less muscle mass. So the systemic diseases, the age factor, the weight factor, the protein factor, there are a lot of factors which will contribute to the weakening of the muscle structure. This sphincter, the opening and the closing of the sphincter is actually controlled by nerves, or especially the vagus nerves. So viral infections, smoking, alcohol, stress factor, these are the factors which will affect the nerves and can give rise to the GERD. So now let's look into the treatment factor. In allopathy, they treat you with antacids. As you know, this antacid is not a permanent solution, because you can take it for a day and you will be relieving the symptom, but that is not a permanent solution. In homeopathy, we have medications to target the causative factor which is causing GERD, like that of stress or anxiety or the viral diseases, like strengthening the muscles. We have medication to correct that. So if you take this medication for a period of time, over the course of time, then definitely you will be having more of a permanent result rather than relieving the symptoms. So starting with, definitely the eating habit has to change. So your eating habit has to be timely, because eating at the right time is very important, because as you know, your body is like a biological clock. If you start eating at the right time, the body will be able to produce the acids and enzymes to digest your food in a timely manner. So eat at the right time and try to eat always between 7 to 8. That is the ideal time wherein you can eat your food, so that you will get enough time for digestion before going to bed. By then the stomach will be empty and the food will move into your small intestine and large intestines, so that the food will not be reflected back to your esophagus. So try to eat early. There should be at least some 3 hours of gap before going to bed. And night food, you make it simple and you make it half stomach, so that it will be easy to digest. And always try to avoid spicy food, oily food, heavy food, citrus fruits. These things you please try to avoid in your dinner time, okay? And always try to include curd, because it's a probiotic and it's very good to soothe in your stomach. So include curd, especially after your food. If you can have a little bit of curd, it is very good for digestion. So these are the things that you can do in your eating style. And drinking water. Although drinking water is mandatory, I always say that you have to drink proper water. Make sure that you don't drink much water while eating and just after eating, because again it will dilute your food, and to regurgitate back to your esophagus, the tendency will be more. So make sure that you drink a little early, half an hour before food or 1 hour after food. Okay, don't drink much of water during eating period and just after you're eating. And sleep. Make sure that you sleep at the right time, and make sure that you sleep at least 7 hours a day. And if you're having any anxiety issue, if you're having any too much of stress factor, make sure that you do the meditation, do pranayama, do whatever you want, but make sure to bring down the anxiety, because that is the reason why, one of the reason why you are ending up in acidity problem. Because I still remember my sir telling me, like 3 things has to be avoided if you are acidic, that is hurry, worry and curry. These three things has to be avoided if you are dealing with acidity. So that's it regarding acidity. And make sure that you sleep correctly. At least 7 hours of proper sleep is very much mandatory if you are dealing with acidity. While sleeping, make sure that you can lift your head a bit, at least the 30-degree angle if it is there. So much of regurgitation won't be happening, definitely because of the gravity factor. So make sure that you lift your head a bit if you are having too much of acidity. And weight reduction is one of the most important thing in treating acidity. So at least the weight around your waist, it should be below 90 centimeter. The circumference of your waist should be below 90 centimeter. So you do the crunching, you do the exercise properly, so that you burn the fat across your stomach. So hope you really enjoyed this section, and if you have any doubts or queries regarding GERD or anything else, you can always reach out to us. You can mail us, you can comment us, you can reach out to us, and we'll definitely getting back to you. And if you really enjoy watching this video, please make sure to like, comment and subscribe. And you also make sure to share it among your friends. So saying that, you stay healthy and fit. Thank you so much.